Hi, I'm Dr. Scott Jensen, and I am not exaggerating when I tell you, if you're a patient, your doctor, your insurance company, your clinic, your hospital, we can all get paid more if we make you sicker. And I think you need to understand that. This patient's on Medicare. His insurance company will get paid more by Medicare if this patient is seen as more sick. There's all kinds of incentive plans being doled out by insurance companies and government programs to clinics and providers and healthcare systems. For instance, one of them that you may have heard of is if a clinic can hit a certain threshold level of patients taking a certain kind of vaccine, they get paid a chunk of money for each one of those patients that took the vaccine. So it's not uncommon to have like an influenza vaccine incentive program, and say you have 1,000 patients that could potentially qualify. Well, if you could hit, say, 60%, you might get this amount of money per patient. If you can hit 80%, they'll give you this much. Literally, doctors can get tens and tens of thousands of dollars on an annual basis for an incentive program as simple as that. Here's another one. If we can call you diabetic based on some parameters, even if we're not treating you with the medication or didn't really do anything for you, if we can call you diabetic and we do a test called an A1C. Now, if we do an A1C and we get a 6.8 reading, that allows us to call you diabetic, even if we don't do anything for you. And when a person has diabetes, generally a doctor or a clinic will get a good mark if they can keep that person's A1C less than 7.5, sometimes less than 8, sometimes less than 7. But if you can call someone a diabetic with an A1C of 6.8, you don't have to do anything. You just get to put them down as a diabetic, and they'll count as a good patient for you because you've gotten their A1C to less than 7 or 7.5. So all of a sudden, you've got this bizarre incentive to call as many of your patients as possible as diabetics. Here's another monitoring.